Hi, everyone. My name is Anna Duncan. I use she, her pronouns, and I work for the CoLab for Community and Behavioral Health Policy, which is housed at the University of Washington. CoLab is currently collaborating with many amazing folks from across the state of Washington for a project called the CARE Project, which stands for Culturally Affirming and Responsive Mental Health Care for Kids and Families. The goal of this project is to promote and increase access to culturally responsive care for kids and families here in our state. So with the CARE Project, my role is really leading partner engagement efforts and getting to connect with community organizations and policy partners doing similar work across the state so that we can collaborate to move the project forward. And in this project, I have the privilege of getting to partner with Dr. Someireh Amirfaiz, who is the founder and executive director of New Americans Alliance for Policy and Research. So today we'll get to spotlight her incredible organization and learn more about their work. But before we start, I'm going to hand it over to my colleague, Mira Mehari.
Thank you, Anna. My name is Mira Mehari, pronoun he, him, and I joined the CoLab team in July 2022 as a research assistant, and I support the community engagement and implementation team with the perspective of serving the underserved population in general and the refugee and immigrant population in specific. And I'm happy to do this interview with my boss and my friend, Dr. Someireh Amirfaiz. Thank you so much.
Thanks, Mira. And Mira actually connected Someireh and myself through this project. So that's been really wonderful. So I think just to start off, we would love to hear a bit about what New Americans Alliance for Policy and Research is and kind of the aims of your organization.
Well, first off, let me just thank both of you. I'm massively delighted and grateful for have this opportunity, and I can't wait to have this conversation with you. So the NAAPR is really my vision for change. To increase the visibility and inclusion and prosperity of refugees and immigrants, specifically refugees, because we don't often hear about them. And one thing that I want to come out of this organization and the work that I hope to continue for a long time is to really make sure that we build policy advocates from the communities that we serve and also build our political power. Mm-hmm. So those are two essential things that I hope comes out of this organization. And then I'll tell you more about why and what we do at NAAPR.
Thank you so much. So yeah, that really leads me into our next question, which is really what is the challenge that NAAPR aims to address, and kind of what led you to the work and to founding this organization?
Great. So let me share some stories with you, because we choose our vocation because of our experiences, mm-hmm. Not our own lived-in experiences, but also our experiences with other people. So I remember it was post 9/11, and we had a group of Somali women whom our employment case manager was taking for a job interview. So they left, and then they came back about an hour later, and the employment caseworker called me and said, "You need to come and talk to these ladies." I said, "What happened?" So I went to the meeting, and then, language was sort of a problem. We had, of course, a bilingual staff person, but they could tell me what happened. She said, "We went to this meeting for this job interview. They looked at us because, of course, they were the hijab, right? And they took their resume, and in front of them, they put it in a trash can, and they said, 'We have no jobs for you.'" Mm. So one of the ladies was crying, and she said, "I'm Black, I'm Muslim, and nobody wants me here." So I mean, this was what, so many years ago, right? And I still to this day remember the emotion, right? And the sense of desperation. And I thought, how, this is not even legal. How can people do that? But they could, because it was post 9/11. So, and a lot of Muslims were penalized for something that they had nothing to do with, right? And then I had another experience in terms of my own children who were bullied in school because although they were born in this country, they were called all kinds of names after 9/11. So, and then we had clients who, like specifically a Burmese mom who committed suicide. And these are the experiences that have shaped what I do. It's like, how can it be that we bring people to this country after they have witnessed atrocities, and most often because of the policies of United States, right, abroad, and they end up here, and there is almost no help in terms of their mental health well-being. I don't know if you know that or not, but refugees are mandated to find work within 3 to 6 months after arrival. So just imagine, fleeing your country, being witness to trauma, spending so many years in refugee camps, and finally legally being admitted here, and then you are forced to find a job as soon as possible. And then what happens is that they get sucked into the cycle of poverty, right? So these are the things that have formed what I do. I have always been an advocate, and I think policy is crucial in making sure that people are heard and that the services and what they get is relevant to their needs. So what I know, and I'm sure you know that also, is what is policy, is what government decides to do or not to do. And that is contingent on how people or a group of people are framed, right? Either they're worthy of and deserving of help or not. The other part of it is how media portrays people and how politicians portray their constituents. So unfortunately for refugees who, and most immigrants who have a Black or brown skin and have the wrong religion, i.e. Muslim, there are enormous obstacles in terms of getting policies that are relevant to their needs. So this in essence is what NAAPR sets to do, to really change the narrative about who refugees and immigrants are, our contributions to the country, and also to make sure that we become visible, right? Because right now, if you search refugees, just do it and see what pops out for you. Like if you do refugees' contributions to the economic success of the United States, nothing comes up. When you look at the housing, homelessness, nothing comes up for refugees because we are not tracked, right? The census doesn't track us. We are subsumed other categories. So for example, somebody who's from Somalia or Ethiopia or Eritrea or Oromia gets under Black African American, right? So you literally are invisible. And of course, I'm in the business of securing funding for refugees and immigrants, and often is, but what are the needs? How many people? But there are no stats and there are no numbers. So that's what we want to change. And we want the community to actually take ownership of that because they have the answers to the solutions to the problems that they face. That was a long-winded answer, but essentially that's what we try to do.
Thank you so much. That was really powerful, and you're just doing such incredible work around promoting this, the work that you do with NAAPR and making sure that refugees and immigrant experiences are made visible and are prioritized. I am curious, before I hand it over to Mira for our next question, you could share a little bit about maybe an example of like a policy you're working on or a dream policy you might be thinking about in the future, just in terms of, really what that might look like in your work at the organization.
Yes. Well, thank you for that question. So previous to 1980, the refugee policy was that refugees could get 3 years of help in order to learn English, to find jobs, and to become economically self-sufficient. In 1980, the Refugee Act of 1980 changed that. So now the federal government provides 6 months of help, and after that, refugees need to find jobs. So this is primary in terms of our focus and changing that. It's been 41 years. Somebody needs to look at this policy and say, it's not working. There are tons of research that says it's not working. Recently, Harvard School published a study on this policy for refugees and their economic success. And they also documented that after 5 years, actually the employment for refugees goes down as compared to other immigrants. So this is something that our politicians need to pay attention to, and this is something that we will be focusing on. How successful we are going to be, we don't know, but I think we need to start the conversation, and we need to, I don't even know if it's legal to do that, but I think we need to challenge it and push our politicians to take another look at this policy and change it. So our refugees would have a chance and not end up on public assistance, right? Which is actually the aim of this policy, to make sure they go to work and find jobs, but it's impossible not to know the language, English language, and be successful. It just doesn't make sense. So that's one of the primary focus for our organization.
Thank you so much. I'll hand it over to you, Mira.
Okay, thank you, Anna. I know when you were talking about the challenge new Americans face when they first arrive in this country, like difficulty adapting to a new culture and finding the stress of finding jobs within certain period of time. It seems it adds and of course being into the new culture and new environment it's challenging. So tell us a little bit about your own experience, like working with this population, the refugee and immigrant. How unique is the behavioral health need of this community?
Yeah, great question. So by training, I'm a mental health professional. And also I was a consultant to mainstream behavioral health agencies on provision of appropriate mental health services for refugees and immigrants, specifically refugees. I also led, I was 8 years director of refugee mental health program as well. So what are the unique aspects of the mental health and the behavioral health of refugees is really this refugee experience, right? And the trauma that comes with it. I mean, just imagine losing your family, your city, your country, having no identity, most often spending years in refugee camp, and then arriving at a new place, not knowing the language, the culture shock that goes with that, and navigating the system when you have no English language proficiency. And there is a maze of systems and services that you need to navigate. There are agencies that help you do that, but then at the end of the day, you are on your own. I remember that, for example, when refugees would come to ESL classes, right? And that blank stare on the face of mothers who, had kids at home and had PTSD and depression and anxiety. And they would say, look, I'm here, but I can't learn anything. Nothing sinks in, right? That's a hallmark of depression, right? So, and not often, almost always, this goes unnoticed and untreated, primarily because the mental health of refugees is always an afterthought, as you know. And even if there is some intention in terms of serving them, where do we find bilingual therapists, right? And when you introduce an interpreter into this intimate relationship between a therapist and a client, I think you lose a lot of things. When I was seeing somebody who is from Afghanistan years ago, it was a young woman and her brother, and they had lost their mom and dad to atrocities committed by Taliban. So, I speak Farsi, and some Afghans speak Farsi as well. In this case, we decided to make sure we have an interpreter as well, right? And the interpreter, in middle of the session, started crying because of the horrific stories that he was hearing. So what do you do in that case? You attend to and then these two young people were trying to actually figure out what do they do now. So I had to attend to that. And we see that often when you bring an interpreter into this intimate relationship between the therapist and the client. Either things don't get translated well because they are not mental health professionals, or the client withholds information. Because it's a small community, right? And there's always a fear that the interpreter is going to tell so-and-so, and people are going to know. So just imagine, even if we have services, if we don't have bilingual therapists, then we are really not serving refugees and immigrants. So those are some of the challenges. And again, PTSD, the refugee experience, culture shock, which often nobody talks about or knows the symptoms of it, right? So those are some of the issues that they face, and is unique to this population.
Well, thank you so much. When you always ask like what's the problem, you always also want to offer a solution, right? So what do you envision as part of like addressing this issue, as part of like your work, your role at NAAPR, and of course you are part of the care team. So like what do you envision can be like a solution to address this problem?
But the problem again is that, the refugee mental health is really an afterthought, right? So first we need to make this population visible. So then we can say, what are the strategies that are community driven, right? Because, sometimes the cognitive behavioral therapy and other methodologies that we use are not going to be appropriate for this population. right? So what are the community-driven suggestions in terms of behavioral health? How do we, because as you know, there's a huge stigma attached. You talk about behavioral health and people say, I'm not crazy, I'm not going to go for therapy. What are you talking about? So can we change it to, yes, this is about brain health, right? Like our body, our brain needs to be healthy. And how do we get there? And when I used to do this training for our clients in terms of culture shock, it's very benign. I made it very benign and friendly. They would turn to each other and say, how does she know how I feel? Right? So normalizing those feelings, telling people that when you feel depressed, which, as you know, we don't have that kind of a vocabulary in our countries, right? And sadness is okay. We are trained to be sad and taught to be sad most of the time. So how do we make sure that it's culturally based and community driven? And what are the protective factors for our refugees? Because they are resilient, they are courageous, and how can we build on that and honor their culture, but also normalize this feeling and help them, right? So not add another layer of stress by forcing them to go to work, but actually making sure that they know the language so they can actually become a fabric of our community and help themselves and advocate for themselves in terms of behavioral health or health, because they are interconnected, right? So those are the solutions. First, make them visible. Don't make them an afterthought, and make sure that you set money aside and engage the community. And I think we will be pleasantly surprised in terms of what they offer us, in terms of what the kind of help that they need.
Wow, thank you so much. And I want to pass on again to Anna.
Thank you, Mara, and thank you, Someireh. That was, yeah, it's just really inspiring what you do. And I think, I can speak for both Mara and I that we're so grateful to have your perspective in the CARE project, which is really thinking about how do we include those who are rendered most invisible in our communities and center their experiences and create policies and create curriculums to ensure that mental health care is really addressing their needs, rather than placing them as an afterthought, like you said. So this conversation has been incredible, and I know that we're wrapping up on time, but just wanted to give some space for any last words you have, or any last thoughts or ideas or questions you're still grappling with, Someireh, about your work, or anything else you'd like folks to know about what you do.
I guess this is my plea to whoever watches this, that pay attention and be a voice. We all need to push back and hold people accountable. So everybody that comes to this country and is processed legally to be here is welcomed and given the tools to succeed. Because refugees is status. After 5 years, people become green card holders and then citizens, right? So we're not going to go away. And I think it's on all of us to make sure that people are successful, because they all come with a zest for life, and the zest to succeed. And it is really our responsibility to push back and hold politicians who are divisive and the media responsible.
Okay, thank you so much, Someireh, for this interview and your support at the collab, and you are supporting the CARE team, both on the co-design and the advisory team, which we are so grateful for your support. And if you want to learn more about Someireh's role, both at the collab and her own work, feel free to reach out at her email address, which is her whole first name, SOMEIREH @NAAPR.org. Thank you once again, and have a good rest of the day.
Thank you so much.